Today what we're going to do, and it was my opportunity to be able to welcome you, and I welcome that, and it's a beautiful sunny day, which we thought was going to be rain, so we were lucky with that as well. And thank you for braving and coming out so early in the morning at 7:30, so that was good, 8 o'clock. I have the opportunity to tell you about our new online virtual menopause program. So what you'll see in the next couple of slides, a little bit of detail regarding the program. You all have your fans. You all have a copy of the presentation, which we're going to have a little fun with. We're going to have like a little Vanna White presentation where we give out some gifts. So we'll have a couple of different things. And on to my right, I actually have 3 experts who you would have access to on our online menopause virtual program. So let's get started. This is part of the Smart Health for Women program. Many of you are already members of Smart Health for Women. And the program's called Let's Talk Menopause. Okay, let's talk. It's estimated that how many women in the United States reach menopause every day? We have a gift. Is it 1,000? Is it 6,000? Is it 10,000? I gave it away, Joe. 6,000 women a day reach menopause. Is anybody surprised about that? Okay. Next question. Menopause is defined as the A, span of time lasting 6 or more years, permanent end of menstruation and fertility confirmed after going 12, raise your hand. The lady in the black, I saw your hand go first. Or C, a social group for middle-aged women. And it's correct, B. So it's a permanent end of menstruation and fertility. And again, there's 6,000 women that go through it every day in the United States. The following are symptoms that can be associated with perimenopause: hot flashes and night sweats, forgetfulness, difficulty sleeping, all of the above. Right here. D, okay? So all of those could be symptoms of perimenopause. This is not a question, but I always like to add some of the stats in. How many individuals of all those women in the United States, let's just say, have hot flashes or night sweats? What do you think the percentage is? Who said 75%? Oh, you're good. Okay, 75%. But out of those 75%, how many really have severe enough causes that they seek treatment for? Is it 75%, 50? 10 to 15%. So it's a lower percentage. Just so you know, it's always interesting to learn some of those facts. Okay, next. Menopause occurs on average, the average age, 45, 55, or 51. The lady in the green, please. 55. What is it? 55. Okay, anybody else? Right here. 51. 51. Joe, we have 2. 51, the average age. So some women reach it earlier, and this is a natural menopause. We'll learn a little bit more, and if you go onto our website, you'll learn there's surgically induced menopause, that you might have your ovaries removed and then you go instantaneously into menopause, or this is the natural menopause as you go through and cycle. Before we put these up here, who wants to tell us a little bit about a hot flash? Who can describe it? Go ahead. I'm sorry, I should tell us your name, Tim. Okay.
Get all hot inside, like you're all inside of you, you're all hot, you get soaking wet, sweaty, and then after that you usually get cold.
Okay. Anybody have any of those? Okay.
I don't have enough books, right?
I know. Does anyone else have anything they want to add to that definition? That's very good. Excellent job. Sure.
I always get really cold before I get a hot flash.
Okay. Okay.
I feel like I'm on fire, and when starts, I start to get this tingling feeling, so I know it's coming.
It's coming.
And then peeling the clothes on and off, on and off, on and off.
Okay.
At night, I'm sticking my feet out of the covers.
Yeah.
Most nights, I'd say 3/4 of nights, I have to leave the bed and go sleep somewhere else. My poor husband can't get up for work the next day.
Okay. Very good. Good addition to our definition. Next, go ahead.
Heart rate increases.
Heart rate increases. So it's pretty uncomfortable. Anybody wake up during the middle of the night with any of those? Okay. So remember, some of the other symptoms are not sleeping real great, you know? So there's a lot of issues that go along with not sleeping a full night's sleep. Anybody knows we're all kind of the same, but all a little bit different. That's kind of the good news, bad news. There's not one fix-it for everything, but there's many different options that we have available and many different things that we have to try, and we're really in the driver's seat to make that happen with our healthcare provider. You'll meet our panel pretty soon. We have Joanna, who's one of the other menopause educators with myself, who we see a lot of different women. We do a lot of different group sessions. We've been menopause educators for over, since 2000 now, Joe. And then we have Dr. Cherise Hamblin, who will tell you a little bit more about herself, and she's an OBGYN who does a lot of work with women. And then we have Eileen Herman, who is a physical therapist who does work with women with urinary incontinence. So there's a lot. This is just a smattering of our panel here that we will have access to when you go on to the virtual menopause site. When we're talking about hot flashes, when you walked in, you should have all received one of these little menopause diaries. Without going into too much detail about them, these menopause diaries, just like you were all explaining, when you have a hot flash, do you ever notice what's going on before you have the hot flash? Did you maybe drink something warm? Did you have some caffeine? Were you stressed out? Anything sound familiar? This guide, this actual little diary is extremely helpful, and we use this a lot. You know, we do a lot for our families, our children, our grandchildren, whomever, and we look at this and keep track of everything for them, but not so much sometimes for ourselves. This is a really good guide to help you notice not only when you have hot flashes, but maybe when you have urinary problems, all of those different things that can come along with menopause. So this is yours to keep. There's several of them up there if you need an extra one. Okay, let's get back to our hot flashes. Now that you described them all, it's a condition resulting in red flushed face and neck, perspiration, an increased pulse rate, a rapid heartbeat, often followed by a chill, memory flashbacks, news flashes for middle-aged women. In the green, go ahead. A, okay, so we pretty much described that all together. So you have to have a little fun of it, but seriously, some women have an extremely difficult time during this time period, but remember again, we're all different. What has helped some of you in the crowd? Or maybe you're not even going through it. Go ahead. What has helped? Okay, all right. Anybody brave enough? What has helped? Go ahead.
Talking about it with other women.
Talking about it with other women. Yeah, and just letting everybody hear her, talking about with other women, just letting everybody know that you're not in it alone is extremely helpful. We hear that a lot in all of us.
Trying to de-stress, do things for myself, because I've noticed the hot flashes always come when I'm nervous or stressed out about something.
Okay, and that's easy to say sometimes, you know, like with the, trying to de-stress. A little bit of stress is okay, but too much, too often. Just think what happens when you're stressed. Your heartbeat goes up. Actually, your blood pressure goes up. Constantly, when you're having all those stressful moments, it can wreak havoc within your whole system. So do something for yourself. Have fun. Do something that is stress reliever for you. If you need to talk to somebody other than your friends, that might be an option for you, and that's an okay option. And just knowing that, because your person sitting next to you or somebody, a relative, may just breeze through menopause, but you're having a really difficult time. We do a lot of different talks too with young girls just starting to get their menstruation. And we do a really nice job. I taught health classes. Joanne and I do programs we've been involved in. And we meet with moms and daughters, and we bring everything to the forefront. This is the same thing at the other end of the spectrum. So sometimes you need a little bit more than just your friends to talk to. It might be somebody professional. That was excellent. Okay, you can feel better during menopause by not smoking, exercising regularly, eating a healthy diet, learn new ways to relax, make time for yourself. Isn't it great that you've come today, and if you're going to join the Expo, to take time for yourself, to really say, I'm important because I can't be good to anyone else until I'm good to myself, and take time for myself. Talk to family and friends. Laugh a lot. All of the above. Go ahead. All of the above. Okay. Anyone want to add anything to that? Okay. So that's a little bit of a smattering of what we're going to talk about with Menopause Let's Talk. I want to leave enough time for questions, and I'll have our panel introduce themselves. But Let's Talk is an online interactive website. It's free. It's reliable information. There's so much information that's out on the website that it's difficult to navigate to say which is the good website to go to get reputable information. Joanne and I and our panel members have really worked closely with the North American Menopause Society. We needed to go take an exam, just like we did we're nurses and physicians and physical therapists. We need to go take an exam to get certified to be certified menopause educators. So what we needed to do is we needed to go to a reputable spot to do that. And the North American Menopause Society is where it's like the guru or the place to go for reputable information. The links that we have on our website link right to a lot of the information. So the information that we're providing to you is from the North American Menopause Society. We have just a few of our experts here from Lancaster General Health that I'm able to tap into to ask questions and give you feedback. But we have all the other OBGYN groups, whether it be May Grant, whether it be Lancaster Physician for Women. We have a lot of the family practice groups. Dr. Gail Sasparo is one of them, who actually will sit with us as well and be able to assist with answering any of those questions. So it's a reliable resource. And the next thing that we'd like to say is there's articles, blogs, there's online question and answer. The questions come confidentially right to me. There's an Ask Rose little icon. I've answered already probably 25, 30 questions so far, and they've been all online. And a lot of the similar questions I can see, a common theme, one being hot flashes. So that is one as well. Also, what are the treatments for hot flashes? There's a variety of different treatments. If you don't feel like you want to ask a question, you can go onto the website as well, and there are the blogs. We also have some research articles that are on there as well that you can just click into. We have a link to the North American Menopause Society. Another one is, I'm having trouble sleeping. Some of those questions that we asked in the beginning. I'm tired all the time. Is this due to menopause? Is my heartbeat racing due to menopause? It doesn't take the place of your physician or your healthcare provider. It's just a reliable resource for you to feel confident to ask the questions, and someone up there said, you're not alone. So it's an actual site that tells you what questions you can ask and give you a variety of different information. My memory is not as good as it used to be. Is it due to menopause? Maybe, maybe not. Does menopause cause depression and moodiness? It could, but doesn't necessarily have to. Some of the other questions, my plumbing is leaking. Does menopause cause urine leakage? We did group sessions. Eileen was one of our speakers. Eileen is a physical therapist who works in conjunction with a healthcare provider to assist many women with physical therapy options to urinary incontinence or bladder issues. Information about feminine dryness and decreased sex drive associated with menopause. I'm finding it harder to lose weight now that I'm older. Is menopause to blame? Anybody's shape changing? That always hits a nerve with everybody, okay? But not actually gain more weight, but it's kind of like centralized in the middle, right? Okay. Now, a lot of those different things too, when we talk about centralized weight gain in the middle. Did you ever hear of the pear shape and the apple shape? Okay. When you're that more of the apple, it leads a lot more to heart disease in that shape. So what can we do? What can we do? Estrogen has something to play. So those answers, those questions, we're doing some seminars regarding that are also available. When do you use hormone therapy? Is hormone therapy appropriate for me? Anybody hear about the Women's Health Initiative several years ago? When all of a sudden word came out and everybody who was on hormones stopped it right away. Okay? Now there's been a lot of research done, and I'll just give you a smattering of information. Hormone therapy is to be used when a woman cannot go through her daily form of living the way she would like to, the smallest amount for the shortest duration of time. So again, it's the smallest amount for the shortest duration of time. The North American Menopause Society just came out with some current research regarding all of the information about hormone therapy, which is on our website as well. Potential health issues. As we get older, heart disease is also an issue and can be. The Smart Health for Women, we also have information about heart disease and different things, but a woman, when she starts going through that perimenopause, the time before menopause, and after when she's in menopause, is at an increased risk. And she needs to take care of herself. And it's due to some of the different hormone levels. What's your family history? How does that come into play? Do you know what your cholesterol is? Do you know what your blood pressure is? Do you know what your weight is? Do you know what your BMI is? All of those questions, they all come into play, especially when you're talking about heart disease. Osteoporosis, thinning of the bones. When's the most important time for you to get what into your system? What do we hear? Calcium. When is it? What age group?
Before 20.
Very good. Before 20, okay? So our daughters, granddaughters, teachers, that is the time frame. It doesn't mean we can't do anything about it at our age, but really that's the time when your bones become the thickest. What are some of the foods that have high calcium levels in it? When should you get your DEXA scan? When should you get a heel scan? What's the difference? What should I do? What are all those? Those questions are also answered on our website. The other one is cancer and some of the risk factors associated with cancer. Excess bleeding might be due to menopausal symptoms. If you're bleeding too much, when is it too much? When should I need to go see a doctor or my healthcare provider? Those are all issues that could potentially be related to menopause. Remember to join onto the website, look at the website, ask Rose a question. I have a whole group of individuals that I can draw upon. Why don't you come down, we can talk with you, or if anyone else has questions. Thank you.